So another big part of planning is financing elder care. I get questions like that all the time. And I don't know that we'll be able to go into all the ways to finance elder care today, but one of the major ways that people finance elder care is the use of their insurance, right? So Medicare funds some aspects of elder care, like home care. Medicare will pay for home care and other things, and Medicaid will also pay for some aspects of home care as well. So let's tackle home Medicare for the first minute because that's probably going to be the easier part of the conversation. Who here takes Medicare reimbursement or can, or do you work with communities or doctors who accept Medicare or other professionals? Jay, do you accept Medicare in the home care space?
Let me just clarify your statement a touch, and that Medicare will in Medicare does not cover long-term home care
Right,
situations,
right.
right? So they would cover very specific situations in the short term. If a person is getting discharged from a hospital, a rehabilitation center, and they get approved for it, then there are things called skilled nursing services where they would come in and they would approve the person for, it could be ADL service, home care, personal care service. Usually people know that as home health aid service.
Physical
So
therapy, occupational
yeah,
therapy
therapies,
at
but
home.
that's usually for a very short window of time.
Yeah.
Typically, call it about 20 days or so. Um, Medicaid for people that financially qualify can and will cover long-term home care community services. So I just wanted to clarify that.
Yeah.
We do not, as an agency, we do not accept Medicaid or direct payment from Medicare, but we absolutely do a lot of supplementing, especially of the Medicare, because typically if somebody comes out of a hospital or rehab, their needs, their direct care loved ones' needs are greater than in the home care space. What, I guess a Medicare service may give them 4 hours or 5 hours, up to 5 days a week.
Yeah.
And in a lot of situations, they need much more support at home than that. And then, so we end up supplementing that Medicare. But we always are asking families because financially we want to make sure that they're taking advantage of any of those support systems that they can, Medicare, Medicaid.
Yeah.
One follow-up to Jay, it's also very hard, from my experience as an elder care attorney who does a lot of Medicaid planning, it's very hard on the Medicare end to staff those cases. So they're getting the hours, a few hours a day for a few weeks, but then they're not able to staff them, and then you have a problem. So it makes it so much more important to have a backup, have a supplement, because
Yeah,
sometimes that supplement is all you have.
yeah, great point in that. We do what we call a concierge service, which is kind of a transition service for families that are getting discharged from a hospital or rehab. But I can't tell you how many calls we get from families that have been approved for Medicare and a service at home. And they've got the nurse coming in, they've got the therapies, as you mentioned, Abby, coming in, whether it's physical, occupational, right, speech. They've got the therapies coming in, but the part that's really challenging is getting the home health aid in there. And that's the part that is critical for their kind of day-to-day feeling good about themselves. That's helping with their personal care stuff, the showering, getting dressed, getting ready for the day. So we get a lot of calls from that, from families saying they're not showing up. We need somebody. Can you come in and help?
Yeah.
Well,
Yeah, when
I
I
mean,
when I work with families who have been discharged and they want their entitlement kicks in for Medicare, it's usually 5 days a week, 4 hours each day, and it has to be the same 4 hour shift each day. And you're absolutely right that sometimes those shifts are hard to fill because they're short hour. Sometimes what I do with families is connect them with an agency that will take both Medicare reimbursement and private pay and maybe even Medicaid so that they can string hours together so they can supplement with private pay if they're able to those 4 hours that Medicare will pay for. Maybe they pay for another 4 or 5 hours a day, and suddenly they've got a case with longer hours that's easier for that agency to fill. So that's sometimes a solution that can work for a family if they're able to manage it.
Yeah,
And so,
absolutely a great
For the
yeah,
solution.
clarification on, you were asking about the clarification of Medicare versus Medicaid. The way we explain it mostly is that, Medicare is a health insurance, and it's basically by prescription. The prescription may be for rehab, it may be for rehab in the home, it might be for pills, but that's what you think about. The doctor gave me 30 pills over 30 days so that I might get help in the home for a period of time to this end result. It's not, to Jay said about long term. That's the key. It's not for long term. It's for short term, a fixed and finite bit.
right. It comes